This is a 6-month-old male with a complex medical history, including VACTERL association, TEF with multiple attempted repairs, laryngeal stenosis, status post tracheostomy, and G-tube dependence, who presented to the ER yesterday with respiratory distress of unknown etiology. Overnight, he had no acute events. He was requiring less suctioning and more comfortable per grandmother. From a respiratory standpoint, he's breathing anywhere from 30s to 60s, which is much improved from yesterday. He's at 97 to 100% on 28% trach collar. He does have some bilateral lower lobe wheezing on exam with some mild supraclavicular retractions. He is getting 2.5 milligrams of albuterol PRN and has received 4 doses in the past 24 hours. His chest x-ray today is unchanged from yesterday's film. ENT was consulted and discussed the need for a vocal cord resection that would occur later in life, but they have no further recommendations at this point. Cardiovascular standpoint, his heart rates have been anywhere from 120 to 180. Blood pressures are 80 to 100 over 40s to 60s, and physical exams unremarkable. Neuro, he has Tylenol PRN and he has not received any doses of that. No concerns from a neurological standpoint. FENGI, after coming back and getting his GJ placed yesterday, he was having some leaking around the site. His abdomen is nice and soft, and that leaking has decreased, so we will continue to watch that. His J-tube, he is getting breast milk fortified with powder at 35 mLs an hour. His goal is 39 mLs an hour, and that will be reached at 9 a.m. this morning. After coming back from the GJ placement, he did have 71 mLs out of his G-tube aspirated. His maintenance IV fluids are off. He did have an esophagram yesterday that showed persistent TEF at the thoracic inlet, and this is unchanged from prior films. He is continuing his home Zantac and multivitamin. From a renal standpoint, his urine output is 1.2 mLs per kilo per hour with stool. He has had 2 bowel movements in the past 24 hours. He is positive 337, and his weight is decreased from 6.6 on admission to 6.5. ID, he had a Tmax of 37.5 last night. He does have cultures pending. Blood cultures have no growth to date. Urine cultures have no growth to date, and sputum culture is currently growing moderate white blood cells, few gram-positive rods, gram-positive cocci, and gram-negative rods. He was switched from cefepime to augmented yesterday. He's getting that in his J-tube. This morning we canceled his CBC due to no clear infectious process going on. So my impression, 6-month-old male with a complex medical history, including VACTERL association, TEF with multiple repairs, and laryngeal stenosis, status post trach, and G-tube dependence, who likely has presented from a viral illness. Plan, respiratory, we're going to try an HME today. He is at his gold feeds, and we're going to make sure that he continues to tolerate that and monitor for emesis, diarrhea, and the G-tube leaking. We're going to continue his augmented pending his culture results, and I don't think he needs to be in the ICU anymore, so we can transfer him to the floor.